My name is Carolyn, and I'm from Rock Hill, South Carolina.
Wonderful, Caroline. And can you tell us just the start of your problem? You were on a trip in Jacksonville and you got hit by a car. Will you just go through the whole story with us?
I was returning from a cruise and stopped to eat at a restaurant and was hit by a car on the way back to our vehicle.
Wow.
And ended up in the Jacksonville trauma ward for a bit and had
How long were you in the hospital?
Just one day, really.
Yeah.
And they, took care of what they could, came back to Charlotte and had surgery there about a week later.
What kind of surgery did you have?
I had a broken ankle, and so they fixed that and some other injuries that they worked on, but really no one looked at the total amount of injuries that I had until I came here. And being a nurse, I realized that there were some other problems going on when other people didn't really think that there were, and or couldn't see them, but I knew they were there. And the first time that I saw Dr. Schwartz without me even telling him what had gone on, he could pinpoint almost all the things that occurred.
Wow.
This maybe 2 or 3 weeks ago, I couldn't have had this conversation with you.
Wow. What was it like 2 or 3 weeks ago?
I had a lot of pain, although I did see some pain management doctors in Charlotte who did help some. They managed the pain somewhat, but no one looked at what the problem was or how to fix the problem itself, except
So they were just
Dr.
trying
Schwartz.
to give you medication?
Medication and some nerve blocks, which helped control the pain, but didn't resolve the problem.
So tell us how much pain you were in. I know you said you couldn't walk, and tell us what your leg looked like.
My leg was a red or blue color. It would change colors. It was kind of like a chameleon. One minute you would look at it and it would look fine. The next minute I'd look at it and it would be red and swollen, and it could swell to 3 or 4 times its normal size within a very short period of time. If a wind or a breeze blew, it hurt. If the ceiling fan was on in the house, it caused pain. So my pain was always between 8 and 10 out of a scale of 10.
So you couldn't touch your leg?
No. It hurt to touch it. So I couldn't really comply with what I was asked to do, even though I wanted to. It just was impossible to do those things.
So you weren't able to work?
No, I haven't been able to work at all. And my mother lives with me, who is 82, and I was her caregiver, and now she's really become my caregiver, and it's been a very big strain on our family.
So
very big.
Were you not walking?
No. I had a little knee walker that I could get around on, and I was giving a cam walker, which is kind of a boot that you put on, but I couldn't wear the cam walker because it hurt my skin even to put it on. And I would try to put it on, and then when I would take it off, it would just cause so much, the blood would rush to my foot, and it was an excruciating pain, and I would just cry for an hour at least, almost every time, when I would try to do what they asked me to do.
So when you arrived at Dr. Schwartz's, you were pretty much not able to move your leg?
That's correct.
Wow. And what did he tell you had?
He told me that I had RSD with dystonia, because my leg would just shake, my foot and my leg would shake uncontrollably at different times.
Wow. And so when he told you that, what did he do?
He has done a lot of testing to see what he could do to alleviate the situation, and he has given me pinpoint nerve blocks. Really, he started in my neck and has gone down my back, and yesterday I actually had one in my foot. He does such a great job. It's a pretty much painless procedure when he does it. He's very careful not to hurt you. He's very careful where he touches you. Probably the most compassionate man I've ever met.
And you work in the medical field?
Yes, ma'am.
So tell us about that. as a medical professional, would you recommend Dr. Schwartz to other folks?
Most definitely. And even since I've been here, and people, you know, in the hotel where I'm staying would come up and start talking about my injury and telling me about theirs. And one person said that his wife was still in pain after 8 months. So I wrote down Dr. Schwartz's name and gave him the phone number so that he could bring his wife in.
So you're already telling people to come and see Dr. Schwartz?
Yes, most definitely.
Wonderful.
Probably one of the, it's just like how doctors used to be. And he really cares about his patients.
That's wonderful.
And so does his staff.
That's great. And if you could tell other people with RSD one thing, what would it be?
The earlier you get treatment, the better off you will be. Your outcome will be much better. Even if you think you might have it, it's always better to get it evaluated early.
So tell them about you now.
My first visit with Dr. Schwartz was a week ago, last Thursday.
Okay.
And I drove up from Charlotte on Thursday and Friday, and then Monday we came in the afternoon, and we've stayed in a hotel all week and just come over in the morning, and he's done testing and getting everything done in a very timely manner, trying to make it fix everything as quickly as he could for us, and in an efficient manner.
That's wonderful. And so how are you feeling now?
100 times better than when I came here.
That's great.
I can't even describe to you the difference.
And you're now walking on crutches.
I'm walking on crutches and using the cam walker.
That's wonderful. So the cam walker is able to go on your leg now without you crying.
That's correct.
That's great.
And I can take it off without crying. And I can actually move at a reasonable pace.